So I'm Stefan. I'm the co-founder of Gyant, and Gyant is a medical AI that does medical triage and also screens people for undiagnosed diseases at scale. We started the company with the belief that we need computers to diagnose us. Why? Because there are just not enough doctors around. There's 500,000 doctors missing in the United States, and the problem only gets worse once you go to developing countries, where demand for doctor services and health services far outstrips supply. So what do you do when you're sick in the morning? You wake up, you have a severe headache. What are your options? It's pretty binary right now. Either you go to a doctor, but then it's a couple of hours, and maybe it's just a cold, and maybe you just wasted your time and some money in the process. But what if it's not just a cold and it's actually something serious? So you're stuck in this dilemma. So you do what a lot of people do. You Google your symptoms, but the experience is not great. It's often cancer, and it's often more confusing than helpful. So we've tried to build a remedy for this. We built Gyant. Gyant is a symptom checker that mimics the doctor-patient conversation. So you start with a description of your symptoms or your chief complaint, and then the AI will ask you questions to figure out what the most likely explanation is for your symptoms, and then give you recommendations on whether to see a physician, stay at home, apply home care, or go seek urgent care. We are live on Facebook Messenger and Alexa, but essentially we're platform agnostic. This could work on text message or in an app or any other service that supports messaging. We are building a product that is consumer-facing, so we want this to be approachable and friendly to understand, because we believe that's what makes the basis for patient engagement. But it's based on reliable medical protocols. So we start with the Schmidt-Thompson protocols and McKesson protocols to build a reliable triage experience. Now, in addition to artificial intelligence, we believe there's an important factor that people have overlooked so far in making this work, which is artificial empathy. When you message patients, you want to make sure that they feel acknowledged and heard. And we actually spend a lot of time developing a system that will acknowledge people's responses and give artificial empathy. And we believe that is the key to engagement. And you can see this in our daily active users supplied here. Yesterday, we had about 35,000 active users that engaged with the product for about 5 minutes and actually come back the next day to return and report on the symptom data. Just to put this in perspective, this is the equivalent of about 1,000 general practitioners dealing with patients who see about 30 patients a day. Now, we get the word out through social media influencers because I have a background in games and e-commerce, and this works really well to get people engaged in the process. And we're now looking beyond just like acute symptom triage to also use this as an application to screen people for undiagnosed diseases, particularly in emerging markets. We have a campaign ongoing with a pharma company already for diabetes in Mexico, and we're looking to extend that to other disease areas like COPD, asthma, and psoriasis and skin conditions. What I'm here today, essentially, I'll be looking to talk to people that are interested in deploying this to their insured populations and member populations. So this could be a great application for health insurance companies or at-risk providers to engage patients and prevent preventable and unnecessary doctor appointments and ER visits, where we can guide people in the appropriate channel of care and save a lot of money in the process. We have a great team, and we've already raised $2 million, but there's always room for more, so come and see me after the show if you want. Thank you.